Hello, and welcome to our second lecture in the lecture series of psychotherapy. Today, I'm going to talk about psychoanalytic approaches. Again, we're using Flanagan and Flanagan's textbook on counseling and psychotherapy. So they also have a video, which I'm going to share with you, actually engaging in the process of psychotherapy. So let's get started. So we'll focus on psychoanalytic and psychodynamic theory and practice. And I think it's important to start with Sigmund Freud. Now, Sigmund Freud, for all the criticisms one may have of him, he's highly influential in our understanding of psychotherapy. And obviously, there are different schools of thought, different approaches to psychotherapy, but we're going to start with Sigmund Freud as the father of psychotherapy. Now, I'm going to start with a quote. Sigmund Freud said that there are many ways and means of conducting psychotherapy. All that leads to recovery are good. And it's interesting, if this were a history of psychology class, I would be talking to you about hypnosis, interest in magnotherapy, a whole bunch of different things before he came to talk therapy that he was interested in and thought that could be therapeutic. But let's start with the question, well, what is psychotherapy? Well, psychoanalytic psychotherapy, forgive me. So psychoanalysis was the term used for Freud's version of psychoanalytic theory and his modality. Now, in classic Freudian psychotherapy, it's a one-person intrapsychic model. What does that mean? The goal of the therapist is to serve as a reflecting pool for you, but not to get overly involved, not to be in the room, so to speak, and have their issues manifest, so to speak. It's about you, and anything that comes up should be focused on you. So the therapist is supposed to act like a blank slate and pay attention or listen for any kind of cognitive conflict or unconscious conflict that you might have that drives maladaptive behavior. So largely, Freud believed that your conflicts occur when different parts of the personality structure are at odds with one another, or when some of the stuff from the unconscious comes to the conscious level. Now, obviously, Freud is a starting point. He is not the last word in psychoanalytic therapy. So there's been an evolution in thought, even within psychoanalytic perspectives. So you're going to be introduced to several of the different lenses of psychotherapy or psychoanalytic psychotherapy. So moving away from traditional or classic psychoanalytic approaches, the more modern approach acknowledges this two-person field. So now, instead of being sort of like a mirror reflecting pool where the therapist tries to be as uninvolved in your experience as possible so that it's truly your experience, now you have the therapist in the room being more active rather than passive. Now, some examples of modern psychoanalytic psychotherapy is, one is ego psychology, and ego psychology shifts the focus from the id and its base desires to the ego, which is the more rational side of the person. So we talk about Freud's followers, and one of the first people we have to talk about is Anna Freud. Anna Freud is a remarkable, or was a remarkable individual. She took Sigmund Freud's work and traditional psychoanalytic principles and applied them to the child first. Whereas Sigmund Freud talks about all of these maladaptive experiences that you might have in adulthood because of childhood. So she does the other way around. Now, even Anna Freud shifted to focus a little bit from the id to the ego. So what are some egoistic functions? Memory, thinking, intelligence, motor control, and so forth. All of these are ego-based. Another common name when we talk about ego psychology is Hartman, and another common name is Erik Erikson. And I'm going to briefly talk to you about Erik Erikson in passing as we go. But psychoanalysts started to shift away from the id, which was pleasure-based, desire-based, to the ego, which was more of your conscious experience. All right. We also have object relations. So object relations theorists focus on libido. And in this context, libido is more life force in general, whereas Freud talked about libido as like sexual energy. And your life force in an object relations point of view puts you to focus on human connection and relationships rather than basic pleasure. Now, what are objects? Well, if you look at a definition in a dictionary, it'll say objects are things. But from a psychoanalytic point of view, objects are actually people and our internalized view of people or versions of people. And things like part objects and whole objects come in mind. Infants start with the concept of a part object. So according to object relations theorists, the breast, the mother's breast, which feeds the child, is the first part object. And that part object is useful in helping the child determine whether that whole object, the mother, is a good part object or a bad part object, or reliable part object, or an unreliable. So depending on whether the child nurses effectively, the child will determine good or bad part objects. And then we internalize that the breast is just part of the person or the whole person. And then that person, typically the mother first, is the first symbol of what society is going to be like. So it serves as sort of a view of the world. And that's object relations. We also have psychologists, which are focused on the more global, cohesive entity. And the self is who you are at your essence or as a whole. So people like Heinz Kohut were influential in self-psychology. So they focus on self-esteem. Self-esteem is your global sense of self-worth, self-cohesiveness, being unified sense of self. These were the focus in healthy development. Now, there is a difference between self-esteem and self-efficacy. As I said, self-esteem is a global sense of self, where self-efficacy is more of like competency based on a specific thing. So overall, I think I'm a good person. I think I'm a wonderful person. I have abilities. But if you ask me about my singing ability, I would say I'm really poor at that. So I would say I have very limited self-efficacy related to singing. Now, could I be taught to sing well? Me personally, the answer is no. Actually, I'm tone deaf. So you'll notice sometimes even in my lectures, I don't modulate sound or tone. That's because I'm tone deaf. So in singing, and I've tried, I can't carry a tune. And that's why I say I have low self-efficacy in singing, whereas I have higher self-efficacy in terms of basketball or sports or things like that. So notice self-efficacy is skill specific or competency co specific. Now, how is self-psychology linked to psychoanalysis? The answer is that Kohut believed that our non-cohesion, nonsense of integrated self, or our belief in worthlessness or self-defect comes from early childhood experience. So similar to Melanie Klein of the object relations, right? Similar to Freud, who talked about fixations, which I'll mention later. All of this is an outgrowth of Freudian analysis, which focuses on childhood experience. I talked to you about relational psychoanalysis, again, similar to object relations. There's a two-person view of psychotherapy, and there's an intersubjectivity, which is really cool because when we talk about things like transference, from a Freudian point of view, transference occurs. From most other psychoanalytic perspectives, countertransference is a big deal too. So my reaction to you is influenced by your reaction to me, and some of my internalized biases, I can superimpose them on you. Some of my internalized baggage, I can superimpose on you. So it's very subjective as a therapist. You're no longer a reflecting pool, just projecting back to the person who they are. Now you're a participant observer. So, all right. So psychodynamic psychotherapy is a general term that emphasizes unconscious behavior patterns and insight as therapeutic tools. So the unconscious and insight-driven therapy are highly psychodynamic. So who's Freud? Well, Freud was born in Freiburg in 1856. And he tended to, even early on, focus on psychosexual development and the unconscious sexual meaning of behavior. So Freud put a strong emphasis on the role of sex in one's whole essence. So he talks about two basic drives, sex and aggression. Now, we're going to talk about psychosexual development and his belief. And when we talk about dream analysis, we'll talk about unconscious sexual meaning of behaviors or symbolic meaning. So in terms of disorders, the main focus of disorders was hysteria. That was a primary focus. And he started to use hypnosis, which made him feel like a miracle worker. Now, one of the problems with hypnosis was that he had inconsistent outcomes. Some people hypnosis worked really well for, and other people didn't work so well for. So there was some kind of influence of the person and their suggestibility. So he started working with Breuer, and Breuer helped him develop this concept of a talking cure to help people talk things out. Now, the time of hypnosis it was with Charcot. All right, so understand that our belief about conditions are shaped by the zeitgeist, which is a cultural or historical context of the time, and the Ortgeist place. So time and place in history influences our perspective. So what is hysteria if it was the main condition? Well, hysteria was a whole host of unexplained symptoms that were related to numbness, paralysis, tremors, things like that, that oftentimes were psychosomatic in the mind. So it's interesting when you did talking therapy or the talking cure, what would happen is when you put a spotlight on the paralysis would shift elsewhere. Now, Freud believed in the seduction hypothesis, which is the belief that early childhood sexual abuse caused hysteria. We don't believe that now. By the way, hysteria Today, the most consistent diagnosis would be a somatoform disorder. All right. So here's his statement in 1896. I therefore put forward the thesis that at the bottom of every case of hysteria, there are one or more occurrences of premature sexual experience. Now, Freud says mature sexual experience starts to occur at puberty or beyond, but child sexual abuse obviously would be premature. So that's oftentimes going to be pushed beneath the surface, the trauma of it. It's going to go into the unconscious. And what causes hysteria is that these unconscious memories start to try and pop up to the surface. And that's what caused hysteria, according to Freud. Now, he did believe psychoanalysis or talk therapy could address hysteria symptoms. Eventually, Freud says, you know what? This idea of hysteria or the origins or etiology of hysteria, maybe I was wrong, so he recants it. But many people believe he only pulled away from the seduction hypothesis because it was, even in his day, people are like, what? That doesn't make sense. Okay, so he switched over from the seduction hypothesis to more of the Oedipus complex. And I'm going to talk to you about the Oedipus complex as we move forward. But there are three possibilities, right, for how Oedipus, the theory works and how he kind of made it fit, so to speak. And it's all about fantasy. So first, right, why did he recant? Well, he saw that the seduction hypothesis was not being received well. But he did see that people did embrace the power of fantasy, right? So fantasy is a good thing, right? So he also abandoned the sexual abuse theory based on professional pressure, and then he projected his own fantasies on his clients. So these are three possibilities. I have seen most that it was due to it not being received well from his peers. So that's the one. And Freud is known for this, where he would shift the theory to fit what his agenda was. All right. So when we think of Freudian theory, it's one of the giant theories of developmental psychology. Being a giant theory, it just means that it's one of the major theories. Doesn't mean that it's correct. It's also been referred to as a museum theory, more of sort of like a historical accounting, like curated view of identity development, because most people reject his identity development model. It's a one-person intrapsychic model, his theory, as I said, versus many of his followers have a more two-person approach. And it has different views of perspective. So now let's shift to more of a dynamic point of view. So, or when we think about it, we call this drive theory or instinct theory. We have two basic drives. One is towards life and pleasure. Eros is that, right? It's our energy towards life and pleasure or sex. The libido, according to Freud, is sex energy. According to many of Freud's followers, it's more of a general life energy. And thanatos is an energy towards death and aggression. So long story short is that we tend to be influenced and driven towards life and away from death. So that tends to be how it is. Now, Freud believed in psychic determinism. Basically, there is no real free will. Nothing happens by chance. Everything is preordained, not preordained by God, but preordained by the mind. And we have these patterns of thinking based on these drives that are predictable and reliable. So every single action you do is based on these basic drives and instincts. Okay, so he also believed that every impulse has an origin, which we talked about the drives. It has a goal, an object or target, and intensity. And then eventually, if you do something over and over and over, you get what's called repetition compulsion. It becomes more stable or consistent as part of your pattern. So Freud also talked about the psychoanalytic mind as being, the mind is like an iceberg. He actually took this concept from Fechner. And then interesting, if you say the mind is like an iceberg, very little is above the surface. Most of it is beneath the surface. But he divided the mind into three parts: the unconscious, the preconscious, and the conscious. The unconscious are the things that are fully outside of your awareness, that are beneath the surface. Usually they're taboos, fantasies, things that are forbidden. The preconscious is not readily available in your conscious, but you can access it. And then conscious is the things that are clearly you have conscious awareness of. So just for definitional purposes, for tests, the unconscious is outside of your daily awareness. The preconscious are sort of latent, like static forces in the brain that can be accessed but aren't currently in use. Now, Freud used this term to emphasize the role of repression in the unconscious. Repression is things being pushed beneath the surface, right? So he wanted to distinguish between things that are fully outside of your awareness or things that you're not using now, but you can access readily. All right. And the purpose of psychoanalysis is to help you make the unconscious experience conscious, to bring awareness or insight to things happening beneath the surface to get some form of a release. So if we were to talk about the theories so far, the concept of the unconscious mind and conscious experience has considerable support. This is one of the things that he said that most modern therapists agree with. I say that because some of the things that he said were more controversial, some and have fallen out of favor, and some of the things we still use. So conscious experience versus the unconscious or preconscious we still use. Now, Freud's psychosexual stage theory of development, as you see on this slide, is one of those things that we largely criticize. Now, I'm going to take you through his theory, and I'm going to teach you all the principles, but I will tell you that most people have criticism of it. So according to Freud, it's called a psychosexual stage theory because pleasure moves from one erogenous zone to another, and there's the possibility of healthy development versus fixations depending on how things go. So from birth to one, we talk about the oral stage theory, oral stage. And according to Freud, pleasure surrounds the mouth. Now, this makes sense when you ask, well, what did he mean? He meant that infants derive their primary source of pleasure from feeding. So in his day, it was largely breastfeeding. Now we have bottle feeding. But either way, feeding practices are the source of pleasure. And it's a stage theory, so there have to be challenges to be met at each of the stages. So one of the challenges you're going to be faced with in the oral stage is when to remove the child or wean the child from the breast, right? Or bottle in a more modern case. So Freud believed that if you remove the child too early, or you allow the child to nurse too long, you're going to develop an oral fixation. Now, let me define what a fixation is. A fixation is unresolved conflict at an earlier point in development that affects you at a later point in development. So an oral fixation might be biting your nails, it might be an eating disorder, it might be being overly sarcastic, things like that. But there is the possibility that you were weaned properly and gradually, so we also have that recognition as well. So there's normal development, and then there's the possibility for an oral fixation. At about 1 month or 1 year or 18 months, typically you shift to the anal stage, and the anal stage, pleasure moves from the mouth to the anus. Now, that may sound weird, but what was Freud talking about? He was talking about potty training or toilet training. As a child gets older, they learn to control their bowels. And there's a tremendous pleasure in going to the bathroom. Now, in general, that's the case, but for a child learning that they can control their bowels, there's certainly a pleasure in going to the bathroom. Now, if you force your child to potty train too early, or you allow the child not to potty train, you could develop an anal fixation. Again, unresolved problems that manifest later. So what would be an anal fixation if you were forced into potty training too early? It's possible to develop anal retentiveness. And that's used literally to hold in one's bowels. I don't want to go to the bathroom, you're forcing me to go to the bathroom. But anal retentiveness, as we get older, is a sense of rigidity or perhaps OCD, obsessive compulsive tendencies. Things need to be a certain way. If you don't potty train, you can also have another form of an anal fixation. And this anal fixation comes in a form of anal expulsiveness, right? Where exceeding messiness, disorganization, ADHD might be a manifestation of that. So, shifting gears to the phallic stage. At about 3 years old, a person discovers their biological sex, and they start to manifest some sex-related norms and attraction, according to Freud. So during the phallic stage, males tend to develop a sense of the Oedipus complex, similar to the story of Oedipus Rex. There's an attraction to one's mother, and the father serves as a rival. Unlike the Oedipus Rex story where the child kills the father unknowing, in the case of the Oedipus complex, it's resolved through identification. So the child starts to learn during the phallic stage that they cannot be with mom, so they'll emulate dad to get a person who's very similar to mom. We also see that for females, they have the Electra complex, which is the female version of the Oedipus complex, where they're attracted to dad, rivalous of mom. Now, right away, as we're thinking, you could see there's a potential of a heterosexist bias, right? So it's assuming that the child is going to be attracted to the parent of the opposite sex or gender. And that makes it heterosexist, because what about the people are attracted to people of the same sex? So there's a bias in the theory. Now, it was also a sexist theory because Freud believed that males were superior. He believed in the male, and based on this theory, he felt that females develop a sense of penis envy at this stage. That is, that they're jealous and bothered by the fact that they don't have a penis, and this is troublesome to them until they get married, and then they capture a penis, is his words. Again, sexist and heterosexist. But for males in the phallic stage, there's this castration anxiety. And castration anxiety is somewhat linked to the Oedipus complex that we talked about just now, where males, one of the reasons that they switch gears and don't go after mother, they go after someone like mother and they emulate that, is because they're afraid that if they were, their father is stronger and has the potential to castrate them. So the anxiety of losing their wondrous organ, as he would call it, prevents them from going after mom. So in the phallic stage, there's a lot going on. There's gender identification, there's the Oedipus complex, there's the Electra complex, there's penis envy, there's castration anxiety, a lot going on. And one of the reasons, and I'm going to shift gears to the next stage in a minute, but one of the reasons why it's fallen out of favor is, as you can see, is very, very focused on male-female relationships, not male to male, not female to female, and there was this bias in favor of males. All right, now, during school age, pre-puberty, Freud believes that you go through a stage theory of latency, where all of that sexual energy that you had kind of calms down. And you tend to seek out same-sex peers, and you tend to play on a playground with same-sex peers. But with puberty and adolescence, you move to the genital stage, where you have that mature sexual energy that Freud was talking about. He doesn't think that teenagers should be having sex or whatnot, but he believed that from an anatomical perspective that the parts work. But that's the top stage. And from adolescence forward, you're in the genital stage. Okay, now, as I said, this is a theory that really is dissected and picked apart. Many people believe that Freud projected onto this theory his own early childhood experiences of being jealous of his father and being loved and supported and overly gushy with his mother, and how she gave him preferential treatment, so that there was this bond. So some people say he projected it, but because of the over-sexual nature, many of the things that we said are actually not founded. So I said that there is an ego psychologist theory, and Erik Erikson has what's called the psychosocial stage theory of development. So instead of focusing on how sex affects the developing person, he focuses on your environment, right? And so Erikson is more of an ego psychologist, and he's more of a lifespan psychologist, just to differentiate the two. Now, I talked about the id in passing, the ego and the superego. So there is this tripartite view of personality. So there's id, ego, and superego. The id is responsible for biological desires. It operates based on the pleasure principle. If I were to come up with a quote that the id might say is, I want it and I want it now. So very instant gratification, pleasure, fantasies, desires, all this stuff is there. Now, when we look at it, it has what's called primary process thought. And we're going to talk about secondary process thought shortly, but primary process thought is more like almost like distorted thinking or hallucination like images or fulfilled sexual or aggressive desires. So there's a very, very strong emphasis on those base desires. We talked about sex and aggression, very id oriented. The ego is the mediator of human personality. And one of its primary jobs is sort of to balance the desires of the id and the values of the superego. So it's kind of a mediator. It's more of operating based on the reality principle. It uses memory and problem solving and logic to achieve its goal. And then these functions are called secondary thoughts. So if primary thought are sex and aggression, secondary thought are processes to help us cope with those sex and aggression impulses, right? So as I said, it's a mediator. Well, a mediator mediates between two things. So it has to mediate between the base desires or primitive impulses of the id, but also, you know, the expectations of the superego, which is more of your conscious and ego ideal. So your conscience is sort of like your view of right and wrong. Now, how do you develop your conscience? Well, that is developed as a function of your parenting, and parents determine what's right or wrong. Eventually, that's internalized, and that is used later by the child. Now, I will tell you that having an overactive id is problematic. You can get into a whole host of impulsive acts, but having an overactive superego is bad too, because people can overly operate based on guilt and shame. They can be paralyzed by fear of criticism, and that's because of perhaps how they were treated as a child. Now, later on, you can self-punish or self-prohibit unacceptable impulses, and the conscience does that. Now, the ego ideal are your more, how do I say this? More in an ideal world, what is the set standard? So the ego ideal has minimal flexibility. You either hit that standard or not. So your goal is to kind of balance that, balance your sense of right and wrong, balance your ideal goals versus you know, what's considered acceptable. So the superego develops as children resolve their Oedipal issues and start to identify with their parents' demands or expectations. So the mind is a battlefield, actually, when you think about this. You have these three forces, and the id is just like instant pleasure, instant gratification. I want it now. And the superego is like, no, that's not right, that's not just. And then the ego has to kind of balance it too. So I said one of the primary functions of the ego is to be a mediator, but another function is to use defense mechanisms or coping strategies to help us deal with things from the unconscious, help us deal with bad feelings, and help us deal with not meeting our ideals. So the defense mechanisms, in a sense, distort reality. Now, these defense mechanisms are actually good and we all use them. So if we're keeping score, this is true. This is true. We all use defense mechanisms. And I'm going to go through them, give you some examples, but I want you to think about, have you ever used it, right? So repression. Repression is motivated forgetting. So if you've ever felt like, no, I don't want to deal with that right now, that is repression. So you just don't want to deal with it, so you push it out of your mind. Now, there is a difference between repression and suppression. Suppression is more of an active process, whereas repression is more of your mind automatically removing it from conscious experience for that point. Denial. Denial is more than just a river in Egypt. No, it can't be, not me, right? It's exactly how it sounds. Now, denial happens often when we hear news that we don't want to accept or we are not ready to accept. So a common example of denial is when a person gets diagnosed with a serious illness. The first thing that they're going to say is, I want a second opinion. And when they say, I want a second opinion, that is sort of them not embracing or denying the first reading, so to speak. So that's denial. And as students, if a person gets a really bad grade on a test, they might say, oh, well, that can't be. Something's wrong with my Scantron or whatever it might be. So that's denial. Projection is to superimpose undesirable traits on another person. So that might be a person who's always agitated and angry, and then they might be with their own partner. Why are you so agitated? So they're putting on that other person what they're really feeling. So they're superimposing it. So that's projection. We also have reaction formation, which is when we feel a certain emotion going to the opposite extreme. I always give the example, if you see a neighbor that you don't like and you've been hiding out and avoiding them, if you bump into them, you're like, hey, how's it going? Where have you been? Meanwhile, you're like, oh crap, I have to have this conversation with them. That would be reaction formation. Displacement is shifting the blame to a safer target. So, if a person is having problems at work and they're fighting with their boss, if their boss is overly critical, then that person may not fight with their boss, but they might redirect that anger towards their parents or their children or their romantic partner, because it's a safer target. You've built up enough equity, they love you, so you might switch the focus there. Rationalization is basically justifying your actions. Regression is to become more childlike. So people will become goofy when they're anxious. That might be regression. And sublimation is when you have this anxiety and you channel it by distracting yourself and putting all your energy into some productive activity. All of these, I bet you've used. Now, there are more than just these, but here are the common ones. So what causes psychopathology, right, from this point of view? Well, the answer is early childhood experience. So from psychoanalytic point of view, your early childhood experience are the origins of psychological distress. Now, the term normal versus abnormal, what's considered a right or wrong, acceptable, unacceptable, it's all on a spectrum. And pay attention to what I'm about to say. Given the right stressor, we all could engage in abnormal behavior. We all could have a breakdown in predictable ways. So, normals and abnormals on a spectrum. So as you're seeing, let's talk about the evolution of Freudian theory. So it originally focused on biological, instinctual, sexual, and aggressive drives, right? So the first focus are drives according to Pine. But it shifted, as we're going to talk about, to ego, object, and self perspectives. Now, I'm not defining it here because I have slides to follow that will highlight what I mean. So let's talk about Anna Freud and the ego, right? So psychoanalytic ego psychology. Anna Freud focused on children directly. She focused on their fantasies, their dreams, their unconscious abilities and processes. And she used a lot of play therapy. She was one of the early play therapists, even before Jacob Moreno. So she allowed kids to draw and play as a way of projecting their unconscious experience into the world. But why am I talking about Anna Freud here? Because about 90% of what she said was similar to her father, Sigmund Freud. But one of the points of demarcation or deviance is that she acknowledged that the ego has some more autonomous functions than her father said. So we have inborn autonomous ego functions, not just a bundle of drives and desires, right? So that's a big shift, right? And I don't think she gets enough credit for that point of demarcation. Now we have object relations. Again, object relations, when I talked about object relations, I talked about part objects and the breast being a symbol of a person. So this is very early in development. This is way before the Oedipus complex. So we're talking about a lot of focus on infancy and paying attention to early childhood relationships. And those earlier childhood relationships with their parents in particular drive how they behave later, right? So we internalize the messaging of how close we are with our parents, and that affects us at a later point. So we might have bad objects or good objects, and therapy is the purpose of identifying bad internalized objects and replacing them with good objects and trying to challenge these negative perceptions. But the die is cast very early based on how your parents raise you. And I'll tell you, this is true. This is true as well. So our parenting affects our child. So be careful, be delicate in your parenting. Make sure that your child develops healthily. And then we have self-psychology, focusing on the whole person. And here, self-psychology, we're talking about healthy narcissism versus pathological. I'm sure that you've heard of narcissistic personality disorder, and people have this distorted grandiosity of self. That's not what Kohut was talking about. He said that there's nothing wrong with viewing yourself as a smart person, a good person, a person of value, and that doesn't make you a narcissist. So you can have a positive ego, right? You could have a positive view of the self without being narcissistic. And then healthy narcissism could also be teaching people that they deserve more, meaning, let's say a person's in a toxic relationship, helping that person recognize that the relationship is harmful to them and they are worth more than being abused. Then we have this concept of mirroring or imaging, modeling the therapist's relationship with the outside world and the therapist versus the client. Now, we will go to great lengths to avoid re-traumatization. So when we try and go back to the childhood, many people, they don't like to go there because of fear of like having to deal with that pain again. So our job is to help you explore that early trauma and be released from the early trauma, right? So part of it is almost reparenting, if you ask me. But we're not perfect. Therapists are imperfect. And it's possible for our clients to distance themselves from us because of our failings or try to avoid intimacy altogether. All right. So we want to work towards empathy in a sense of a holistic sense of self. These are part of this self therapy. Now, other points of view, and it may seem like a hodgepodge because Freud had a whole bunch of disciples and they tweaked his ideas. But so there isn't a uniform view within the psychoanalytic movement, and the development has not been linear, right? So each person you learn about will challenge something in Freudian psychotherapy. And you may remember Freud talked about penis envy, right? And the male superiority mindset. Well, Karen Horney, which was one of his disciples, challenged this idea of male superiority and penis envy, and she rejected it. And she actually argued something which has also been rejected called womb envy. But she says, no, women aren't jealous of men. Women aren't, inferior to men. In fact, there's a special power in women, and men are jealous of women because women could give birth. So each of these newer versions of psychoanalysis challenge early Freudian therapy. So we have time-limited psychoanalytic therapy because Freudian psychotherapy was long-term, 5 days a week. Sessions might be 90 minutes at a time, but it was every day, 5 days of a week, and you could be in there for years. So in a modern point of view, we have to kind of shift this and become short-term solution focus. And that's what Ferenczi did, made it less suggestive. The therapist became more active in treatment versus earlier versions, which are more passive. And then Alexander and French focused on corrective emotional experiences, which are helping you be exposed to more desirable circumstances and coping with more emotionally difficult experiences. So the relational psychoanalytic movement, as I keep saying, is more of an intersubjective or two-person therapy. So now they acknowledge that the psychoanalyst is subjective, they're also involved. Now, once you say that the therapist is involved in a treatment, you have to deal with countertransference. Now, countertransference is the tendency of the therapist to see the client in more of their life or their unresolved issues, and they superimpose that onto the client. So based on their experiences, what they want, what they have unresolved, they might superimpose it. Now, totalistic countertransference is more of a contemporary view that countertransference is made up of all the reactions that a therapist may have to the client. So it's more of the sum of reactions. All right. And it's interesting, countertransference happens. So if you ask therapists, do you like all of your patients? The answer for many is no. Sometimes our patients activate things inside of us, but it's usually unresolved issues we have. So we might have a negative countertransference towards our client. And that might be based on the holistic view of them. Now I want to talk to you about attachment. Now, attachment theory is you can't take a developmental psychology course without learning it, but this is based on the emotional bond between a child and their caretaker. And what we believe is how that bond develops is going to impact future interpersonal relationships. So the early person, which most people know, is John Bowlby, right? So he focused on real parent caretaker interactions with their children to determine the bond. And then you have Mary Ainsworth, who developed what's called the strange room experiment, where she took Bowlby's theory and did an experiment to talk about the different attachment types. And in this theory, in this experiment, pardon me, she had a child enter a room with a parent. They're alone by the parent child in a playroom. A stranger comes in, stays far away, starts to move closer to the child, talks to the parent. Parent leaves the room, tries to engage the child. Then the parent comes back into the room, the stranger leaves. So all of these different stages. And what Ainsworth believed is how you react to your parent or caregiver leaving the room and returning to the room will dictate the kind of attachment style you have. And Ainsworth came up with 3 patternistic forms of attachment. Secure attachment occurs when there is this separation anxiety. So when mom leaves the room, the child is distressed, mildly distressed. When the child interacts with the stranger, there's stranger anxiety, uncomfortability with this unfamiliar person. But when mom comes back into the room, the child runs up to mom and is comforted by mom. And I say mom because a lot of these studies are early with mother-child interactions. So a secure attachment would be distress, mild distress by the parent or caregiver leaving, and comfort in their return. Now, an anxious, and I'm going to go out of order if you don't mind, an anxious-avoidant insecure attachment is where the child is apathetic about your leaving. They don't care that you left. And when you come back, they don't run for you for comfort. So you could come, you could go, there's no distress whatsoever. So that is more of an avoidant. They just don't come back to you for comfort and security. So you don't serve as a secure base for them. Now, an anxious resistant insecure attachment is one where, remember I said in a secure attachment that the child is supposed to be somewhat distressed by you leaving? With an anxious resistant child, the child is very upset, very distressed about your leaving. But when you come back, not only do they not approach you for comfort, if you try to approach them, they might push you away, kick you, bite you. So these were the 3 attachment styles that Mary Ainsworth talked about. But her student, Mary Main, added a 4th, which was the disorganized or disoriented attachment style, which is kind of unpredictable, unusual responses in an unstable way. So secure attachment, mild distress by mom's leaving, comfort by her leaving, coming back, comforted by her coming back. Anxious avoidant insecure attachment, no distress by leaving, no comfort when coming back. Anxious resistant, significant distress by leaving, resistance when coming back, and then disorganized as unpredictable patterns. So that's attachment theory, and it's not wrong. In fact, Sue Johnson takes this principle and comes up with emotionally focused couples therapy. And she talks about how these attachments that we had or improper attachments affect us in relationships. So we need to resolve you know, unanswered or unaddressed problems from our childhood to have healthy romantic relationships. So, what is the goal of psychoanalytic therapy? One is to bring things from the unconscious mind to your conscious experience to increase awareness. So, it's insight oriented. It's also to help you address maladaptive impulses. It helps us get rid of unhealthy internalized objects, replace them with better or more adaptive objects, any kind of self-defect we fix through mirroring, empathy, and support. Now, when we assess a person, there are many different interventions we could use from a psychoanalytic point of view. Clinical interviewing is very useful. You can probe deep into the unconscious, or you can engage in projective testing, which is more abstract. So Rorschach, inkblot, what do you see, could tell us about how you perceive the world. Thematic apperception test, which is a picture test where you tell a story about it, can tell how you solve conflict. Free association or talk therapy could tell you things. Human figure drawings can give me insight as to how you see yourself, and so forth. The biggest criticism of projective testing, though, is it's very subjective, so you don't get consistency. But let's talk about talk therapy. In this principle, we are going to have you say whatever comes to mind. There's no right, there's no wrong. And what we're doing is we're actively listening for any kind of unconscious conflict. And then when you talk about that, we ask you to elaborate more and we process it together. So we have different procedures, right? So different functions and skills we use. So interpretation is one of the main tools of helping people develop awareness. So now, obviously, our interpretations are subjective. We could have our problems with that, but nonetheless, interpretation is one of the main tools. Developing a therapeutic alliance, again, empathy, unconditional positive regard, all this stuff that we talked about in the first lesson still is relevant. Role induction. So role induction is where we teach our clients about their role in the therapeutic process, and how, what we expect of them. Timing. You can't pick at everything. You have to strike certain things as appropriate. So using good timing, paying attention to transference. The same way a therapist can have positive emotions towards their client or negative emotions towards their clients, or even erotic emotions towards their client. The same thing can happen from a client's perspective to the therapist. So we want to pay attention to whether they've developed positive, negative, or erotic transference to us. We also, as I wanted to say, pay attention to our feelings about our clients. And then we focus on triangles of insight, which I'm going to cover on the next slide, either conflict or transference based, and then dream analysis. Now, dream analysis are Freud believed were the royal road to the unconscious, require interpretation. Another thing that Freud got wrong was in his dream analysis, he overly sexualized them. So he looked for phallic symbols in your dreams and interpreted it based on sex and aggression. Now, today, dream analysis is much more collaborative, much more interactive. The client is the expert on their dream, not the therapist in this context, whereas Freud would talk to you about what the symbols meant. So if we're keeping score, Freud's psychosexual theory of development is highly criticized. His dream interpretation is highly criticized, but his concept of the mind, id, ego, superego, conscious, preconscious, unconscious, defense mechanisms, transference, countertransference, all of these things he got right. Now, so I said there are these triangles of insight. So let's keep score. So conflict-based, the three elements are whatever your goal, wish, or drive is, any threat to accomplishing that drive, and any compromise you can come up with. Those are the three elements of conflict-based. Transference-based triangle of insight is more of transference observation, your early childhood patterns, and how they link up with your modern relationship patterns. So each of these have three elements that are related to them. Now, I'm going to stop here for a moment and show a video. Now, it's 25 minutes long. I'm going to shut off my camera as not to distract while the video is going on. And it's part of the resources that we have. So let me pull that up. And I have to first stop recording, and then I'm going to pull it up.
Psychoanalytic or psychodynamic therapy?
If I were to say one thing about the psychoanalytic perspective, it would be repetition of patterns, whether you're operating from the old-fashioned Freudian perspective or the more modern attachment theory perspective. Both of those perspectives emphasize that individuals develop an internal working model based on early childhood interactions, and that model dictates to some extent that repeating pattern of the way people have relationships, as well as certain kinds of conflicts or intrapsychic problems that are manifest over and over.
And psychoanalytic is a very long therapy process usually. So of course it's difficult to squeeze any of those concepts into a 20-minute session. John's listening with Sarah for repeated themes, including the things she brings in, which is concern about blushing.
And what you'll probably notice is that the listening that I do is fairly unstructured. It's involving free association or saying whatever comes to mind, which is one of the techniques that psychoanalytically oriented therapists use. In addition, I will occasionally prompt her to explore the past to see if we can make some connections with how these particular problems, the blushing, first arose.
Yeah, your goal is to help Sarah begin to explore those repeated patterns in her life.
Absolutely. And as I do that, another thing to keep in mind is countertransference, because countertransference can distort the way I see Sarah's problems. And that's one of the reasons I think from this perspective, it's so important to go slowly, to work collaboratively with clients so that we can make sure that my reactions or my distortions of her problem aren't what's guiding the session, and it's really her issue and her problem.
So let's watch a few minutes of John working with Sarah.
So just start with the thought of your face blushing, maybe an image of it in your mind, and then just say whatever comes to mind.
Gosh, the words I feel like sound so harsh, but really I think of embarrassment, humiliation. I feel like I look stupid. Those kinds of things.
Pretty harsh things. If you go back in time, starting now, but just go way back as early as you can you think of humiliation, embarrassment, experiences where you maybe first started having that kind of flushing?
You know, it probably was when I was in college, and there were people that would say, "Oh my gosh, your face just turned red." And I actually had someone that I worked with that would say to me, "Oh, I just love to embarrass you and watch your face turn red." And I can remember that I hadn't been that aware of it, but then there was just something that it just started, the awareness, I think, it just started happening more and more often.
Yeah. Back in college, it's an early time when you remember it. Can you remember a particular time when you flushed and what was going on then?
When I was in high school and the teacher would ask a question, I would feel fine answering a question and speaking up.
Mhm.
And when I got to college, I wouldn't, because I was afraid my face would turn red.
Mhm.
So it's just that I'd be in class and I would feel like I had something to contribute, but I didn't want to talk because I thought it would draw attention to myself.
Mhm.
My face turning red. Yeah.
What might you have said that would make your face turn red?
No, I wasn't really worried about the content, but I think that just talking
Mhm.
in a group, it just, I knew it would turn red, and the idea of it turning red and people thinking, gosh, look how insecure she is that she can't even talk without her face turning red. I just didn't want to deal with it. So I sort of quit talking
Mhm.
in class. Yeah.
And so we started with what causes the flushing
Mhm.
or the blushing. And it seemed like that was related to some things in college and people bringing that to your attention. And as you focused on it more and more, it seems to have gotten less and less in control. That'd be right?
Mhm. Yeah.
And so now we've moved to talking about some safety concerns about your children mostly, but just tragedy striking you.
Mhm.
And again, it seems like maybe in some ways, the more and more you try to control your worry thoughts, the less they feel in control. It kind of feels like they keep getting bigger and bigger. Is that?
Yeah. Mhm. Yeah. They do. And I have periods of time where I don't feel this way, um, but yeah, I have a lot of thoughts of just wanting to live like a normal person and not having all these thoughts all the time in my head. And I wonder, as we're talking now, if I just kind of am living a little anxiously all the time, and that's maybe affecting I don't know.
Yeah.
I mean, that's what it feels like right now.
Yeah, kind of this underlying anxiety. Something might go wrong.
Hmm.
Something bad might happen.
Hmm.
Something that could be a tragedy. And the first thing you think of is the car accident sort of thing. And what else? What are the kinds of tragedies or just even small bad things might happen?
I don't worry about small things, honestly. I mean, I I don't. I feel like I'm pretty good about that. I don't want. Yeah, I can categorize things like, okay, with when my kids play really rough a lot, and I think, well, that would just be a broken limb, so we can that go ahead. But when it starts to be, well, that could be a big head injury, then and I think of all that. I mean, I go through the whole checklist in my head a lot. And I don't feel like, do other people do that? I mean, I don't know. I'm always questioning, like, is this crazy to be just constantly having this in my head? And I think to my kids that I hope that I appear completely calm. That's how I want to appear, because I don't want to put this on them. But
You'd like to have it in your head less. Whether other people are crazy or whether it's crazy or not, you'd like to have it in your head less.
For sure.
Yeah. And what kinds of things have you tried?
Well, I always think about, whenever I'm challenged with something, I always think about the worst case scenario. And I believe completely that I can handle anything. And I've gone through this whole list. Like, if I, lost my limbs or whatever, I can handle anything, but I can't handle something happening to my kids. And that so when I try to approach this logically and think, well, so and so has made it through life without a big thing happening, and so I mean, people just have a lot of tragedy, and so I just come back to that
and feel that underlying nervousness. Yeah. And yet, if we go back to the blushing, that's not a bad thing happening. Someone speaking up in class, not a bad thing happening. And yet that feels kind of out of control too.
It does, because I really hate to be perceived as stupid. Mm-hmm. And that's kind of a thing that goes way back for me too. When I was younger, I had this persona that developed that I was an airhead. And I've had to work so hard to kind of, because I think I used it for a while to my advantage. And then in college, again, I had to work so hard to get rid of that whole image. And it still is kind of in there somewhere, I think.
Still sort of have some fear of being perceived as an airhead, wanting to prove that you, in fact, are not. And you used the word stupid. Go with that.
I don't know. I really value intelligence, I guess. I value it a lot in other people. And I don't know. I hate that I let myself have that persona for so long. It really bugs me. I feel like I could have done other things with my life if I hadn't gone with that so much.
What was going on to make that seem like a good thing then?
Oh, I don't know. I don't know. I mean, people gave me attention and laughed, and I don't know.
What kinds of things did you do?
You know, I said some silly things like, this is in 7th grade, but when I see these people, they'll bring it up.
What did you say in 7th grade?
Oh gosh, really? There was something about a pen that had a calculator in it, and the battery died on maybe it had a digital clock in it, and the battery died, and I didn't think the pen would work anymore because the battery died. It was just a split moment thing, but everyone laughed and thought it was hilarious. And I think that's kind of when it started. And so people still 30 years later, oh, do you have a pen, Sarah? And I can laugh. I mean, I am totally fine laughing at myself. That's not the problem. It's just, I just don't want that identity that I'm dumb.
And you kept it for a while.
Like a long time.
Yeah. What are some other examples of?
Really? Another one that comes to mind is someone told me that their aunt had had a miscarriage, and I asked her if the baby was all right. So, because I knew, I don't know, but that was just a dumb thing to say. I didn't mean to say that. And so that's another thing people bring up 30 years later.
And that doesn't sound intentional.
It wasn't.
The pen and the miscarriage comment.
No.
And yet one of the things I kind of hear you saying is, well, that's embarrassing, but it's even maybe more embarrassing that you kind of took on that identity. Rita, while I was watching the clip of Sarah, one thing that I noticed was that kind of repeating or recycling pattern where initially when she was asked about the blushing, she went back to a college experience. Later, she goes back to a high school experience. And later, she goes back to a 7th grade experience. And what that reminds me of is how maybe resistance is diminished over time. Maybe trust is built. Either way, it seems like as from this model, you look at things in the past, you uncover different perspectives each time.
Yeah. One thing I noticed during the session is you asked her what she had done before, which can kind of sound behavioral, actually.
Right. It might also sound solution focused, but the reason for asking that is to really sort of glimpse or study her pattern of trying to resolve the problem herself, because that's important to the psychodynamics. And, in addition, I felt the impulse at one point, like maybe I should have asked her, what do you think I think of you? Which would be a question that's very psychoanalytic because it kind of pulls for the transference that might be happening in the session between Sarah and me.
Which maybe would have worked or maybe would have been a little early for that kind of reflection.
Absolutely.
Yeah. So the next clip picks up right where we left off.
Exactly. So let's watch. But it's even maybe more embarrassing that you kind of took on that identity. Or did you take it on? People put it on you?
I think people put it on me after that, and then I went with it after that. Those are the two things that I really remember saying that were the worst. And then after that, I just kind of went with it.
And did you ever intentionally say things that were?
Oh, probably. I mean, I really don't remember other things, but I probably did act the part for a while. Yeah.
As you talk about it, it seems very, not really unsettling, but just like you.
Yeah, it makes me cringe.
Yeah. How about even before 7th grade? Anything where you felt like you were perceived as stupid?
No, I was pretty smart, really. So no, it's kind of a middle school thing.
Somehow you carry on this sort of remnant from middle school, that people might see you as stupid, and that carried into college. And even now you feel that the blushing might be related to that thought of maybe I'll be caught. Maybe I'll be caught looking stupid.
Yep.
And the theme with your children is maybe I'll be caught unprepared. Maybe tragedy will strike because I'm not prepared.
Well, when you say that, it makes me think that, yeah, what if I wasn't worried? Would that make the odds go up that something could happen?
What if I wasn't worried about tragedy? What if I wasn't worried about being viewed as stupid or unprepared?
Well, when I'm thinking about the tragedy part, I mean, what if I let that go and it wasn't on my mind all the time? Then maybe that would make the odds of it happening go up. I don't know. It sounds ridiculous when I say it, but
yeah. But you hear this sort of belief in your mind. Maybe worrying about the tragedy helps prevent it.
Yep. I think that somehow that's what I think.
And that prevents it, even in the absence of any specific precautions. I mean, is it possible to take the precautions and then
Let it go?
let it go?
I don't know.
Seems like there's some things that are outside your control.
Yeah, I don't know. It feels like if I let it go, then what does that mean? I don't know.
What does it mean?
It feels a little bit like, now am I being careless if I just let it go? And what comes to my head is, do I love them less if I just let it go? Which sounds really weird, but I don't know. It feels scary to let it go, I guess, but I want to let it go.
It would be nice to let it go. But somehow there's a little superstition in your head that if I let this go, maybe the odds will be worse, and maybe it's a sign that I don't really love them, that worrying about people is a loving thing.
Yeah, I guess so. I've not thought of it like that, but that's sort of how it feels like. Yeah, it feels that way. I mean, it sounds so illogical, but that's how it feels right now.
But that sort of feels, and when you just go with that, or that thought of if I worry, then it's love. It's a sign of love. Where do your thoughts go? I worry.
Well, first, I feel like my love for them is so much more than worry. So I don't equate worry with love.
Mm-hmm.
But if I were to just let things go, I perceive other people having more normal thoughts in their head. And if I perceive like just letting my kids get in a car and just go somewhere and let it go, I do. I let them go in car. I mean, I do. It's just hard for me. And to imagine myself doing it without having the worry in my head, I don't know. It feels careless.
And what does careless mean?
Then I feel a little bit, I think of being negligent, and then and that's when it'll happen.
Mm-hmm. Carelessness is negligence. Just talk your thoughts, even as we sit here, whatever comes.
I just feel like I'm in this, I'm stuck. Like I want to stop worrying. I want to live and not live with all this fear. Mm-hmm. But I feel like I'm bound to it. And I'm just stuck all the time. Mm-hmm. And I want to be able to think about other things and not be thinking about what kind of car my friend's mom drives, and is she going to text or talk on the phone while she's driving my kid, and what about the other person, and my husband, and and I mean crazy things. Like I sometimes will, without anyone knowing it, because I think I read that being on the left is more dangerous, so I'll switch and make sure they evenly ride on the left and right. And if I put one of them on the safer side, does that mean I love him? I mean, the thoughts are just crazy. Mm-hmm. Yeah, it's embarrassing when I hear myself even have these thoughts out loud, because I blush. I know. I feel like I keep this part, like I try not to let people know about it, because I know that it's kind of crazy. And I don't want to put it on my kids. I don't want them to have to live with that.
You spend a lot of time really protecting people.
Mm-hmm. Mm. Like protecting them from knowing that
protecting them from knowing, protecting them from tragedy, worrying about lots of different people who you love. Who protects you?
Just me. I mean, I do. My mom was always a little bit like this, mm-hmm. So I do blame some of this on her.
Talk about how did she do it?
Oh, she just always was worried, and I've been really mad at her in the last few years, because she'll bring up some concern, and I'm like, if I haven't thought of that concern yet, I certainly don't need to hear it from you, because I've thought of every concern. So I've told her, you have to stop putting your worry on me, because I've got enough. And I've been really clear that I don't want to live that way. Mm-hmm. She thinks that I am way more this way than she was. I don't know if that's true. Mm-hmm. But
so some of it you feel like you've gotten from your mom, mm-hmm. over the years, and that she was a little bit like this. Mm-hmm. You're not sure, maybe she's even more than you or less than you.
I don't think she tried to hide it from us.
She just sort of explicitly worried about your safety.
Mm-hmm. Yeah.
You and your sibling?
My sister and my brother. Mm-hmm. Yeah, I don't think she tried to hide it from us. I am really determined that my kids will live a fun life.
You'll not only protect them from tragedy, but you'll protect them from their perception of you worrying too much.
Right.
You know, Rita, as I watched myself working with Sarah, one thing I noticed is I didn't really do any formal interpretations. And really what I was doing was prompting her to look at her past, trying to notice what patterns might come up. And I think in a lot of ways that might be more appropriate than jumping in there with deeper interpretations.
Right, especially at this stage. But the interesting thing is, I think Sarah actually had some insight, and you could kind of feel that in the tape as you watched.
Right. She was working away, and I did notice that toward the end, Rita,
the mother came up.
And Freud would be very happy that that occurred.
Yeah, in historic analytic work, all roads lead to the mother.
But in reality, we know that it's not just the mother. It's the mother and the father, the caretakers, other significant people in the person's life that somehow shaped that internal working model that eventually causes some issues or difficulties to repeat themselves. And I guess in closing, I just would like to say that Sarah was a fabulous client, and that I think she has potential for lots of insight that might help her work through some of the issues that she presented in the session.
Absolutely.
Okay, so so I think that video does a good job teaching several things. One is, I loved when he said talk the thoughts, right? So the idea of free association is just say whatever comes to mind. There's nothing wrong. Whatever pops into your head, just let it out, and then we'll kind of interpret in a very tentative way as things go. So he did a very good job getting his client to free associate. In terms of interpretation, it did seem like at first he was struggling to get her to go, but I did like how he tracked her thoughts, her negative thoughts of self, and appearing like an airhead or stupid, back to earlier points in her life. And I bet if that session went to another session, we could get to a point where we could find out who in her early childhood gave her messages, those negative critical messages that made her feel that way. And she said, oh, 7th grade. But then she started to talk about her mother and how her mother kind of, trained her to be this way to some degree. And some of her mother's anxieties were superimposed on her, and now she carries them forward. But I would be curious to see if any of the negative self-talk comes from either her mother or her father or anyone else who is responsible for early caregiving. So who knows? I think it did a good job. He helped her work through some resistance from the first half of the session through the second half, where she started to become a little bit more open and candid about what she was experiencing. And this is the kind of video that you could play back and see new things every time. So that's Flanagan. Actually, John and Rita are actually husband-wife team. So it's nice to see them interacting with one another. They're both psychologists and, feeding off of one another that way. All right, so let's shift gears to the next slide. So let's start to evaluate psychoanalytic perspective. So you will read in some textbooks that, there's limited support for the effectiveness of psychoanalytic treatment. And I'm going to say that's not true. Like I'm a big proponent of psychoanalytic practices, even though my dominant theoretical orientation is cognitive behavioral. But I've seen, and there's data to indicate it works for depression, anxiety, somatic problems, eating disorders, substance use disorder, personality disorders. And these are just a few, right? So there's a wealth of research. And I think it's good to mention Jonathan Shedler and how psychoanalysis looks very different than Freudian psychoanalysis. And he does a lot of the efficacy studies and supportive data for it. Now, look, as with all studies, some studies that lend support have flawed methodologies. Doesn't get into the literature often, but sometimes it's either weak or flawed. We also know that there is this allegiance effect, which is research suggests that a researcher's therapeutic preference is an indicator of the study outcome. So there's cognitive behavioral researchers who suggest that cognitive behavioral therapy is more effective, and then more psychodynamic researchers support psychodynamic principles. So there's an allegiance to what one practices. We also see that there's a confirmation bias in research where people identify information that supports their pre-existing beliefs. They discount information that does not support their beliefs. So there's kind of this push-pull. So in terms of cultural sensitivity, I would say that Freud did not put too much of an emphasis on cultural factors. He largely ignored race and ethnicity, highly individualized his treatment towards the patients and focused in their inner workings rather than cultural factors. Now, that doesn't mean that today psychoanalytic theorists are the same. In fact, the American Psychoanalytic Association actually has been putting on some really great programming on race and equity and health disparities and some really fascinating stuff. But if we were to go to the early work, there was not a great sensitivity in the research. Now, gender and sexuality, you could see in Freud's work that there are some anti-women biases and some pathology of homosexuality. In fact, Freud would refer to homosexuality as an anal fixation, right? So you can see even in the video that there was potential blaming of one's mother, right? So again, what about one's father or other caregivers? That was kind of lost. But as I said, there has been more of a shift towards inclusivity in terms of the LGBTQ plus spectrum and feminist perspective. So what about spirituality? Freud was an atheist, but his family was Jewish. So oftentimes he would describe himself as a godless Jew. I actually like that to some degree because it highlights that Judaism is not just a religion, it's a culture as well. And then obviously early psychoanalytic and behavioral theorists used to rip to shreds religion and spirituality, saying it had no business in the treatment room. However, now there's an acknowledgement of the benefit of religion and spirituality, and it deserves far more respect. And actually, if we go back to the superego, you could find out a lot about the role of religion in the superego if we don't just throw everything away. So that, in a nutshell, is today's lesson. I hope that you enjoyed. And we're going to continue with Adlerian therapy in the next series. So I'm going to stop here.